Here on your Tuesday. Thank you so much for staying with us. May is nationally recognized as Stroke Awareness Month.
And according to the Centers for Disease Control and Prevention, more than 795,000 people experience a stroke. Due to this, we wanted to speak with a Triad doctor to learn more about prevention and treatment options.
So joining us live now is Dr. Jaquita Baldwin. She is a neurologist with Atrium Health Wake Forest Baptist. Good morning, Dr. Baldwin. Thank you for being with us.
Good morning. Thank you for having me.
Absolutely. So let's just start with the factors that put people at risk of having a stroke. What can you tell us?
So there are two different types broadly of risk factors, some that we can't change and others that we can. Things we can't change are like our age, our sex, our ethnicity. Other things that we can change include high blood pressure, high cholesterol, smoking. And those are the things that we really do focus on with trying to prevent people from having a stroke. So staying on top of your blood pressure, monitoring it closely with your primary care doctor, and trying to get to that goal of less than 130/80 is a big thing that can reduce your risk for a stroke. Also helping to eat, working with your primary care doctor to eat a balanced meal in terms of green leafy vegetables, avoiding red meats, things that are not going to be high in fats, especially saturated fats like fried food. And then if you smoke, trying to cut back, thinking about cutting back. There are lots of options and things to help quit eventually.
And Dr. Baldwin, what about spotting some stroke symptoms? This is really important to remember, the acronym, right?
Yes, so be fast is what we tell everybody, all our patients that we see in clinic. These are the signs and symptoms to look out for in case you're having a stroke. So the B stands for balance. If you're having trouble walking, if you feel like you're not coordinated, you're dropping things or feel clumsy, that can definitely be a sign of stroke. If you suddenly, with the E, have vision loss or blurred vision, double vision, that also can be a sign of stroke. If you're talking with someone and your face looks droopy on one side, or if you think your face feels a little bit funny and you look in the mirror and one side isn't moving as well as the other, that can also be a sign of stroke. A is the arm, so arm weakness or numbness. If suddenly you can't move one side, that you need to go to the hospital immediately. The S stands for speech difficulty. So if you're suddenly garbled or slurred, people can't understand you, or you just can't get words out properly, definitely call 911. That's what the T stands for, time. Time is brain. The sooner we recognize those symptoms and get treated is the best chance of recovery or full recovery.
And Dr. Baldwin, what are some of those treatment options when someone is in the hospital, the stroke has been identified?
So there are two types of treatments. One is medication-based. It's basically a clot-busting medication that we can give to break up a blood clot that could be blocking off blood flow and causing a stroke. The other is a surgical intervention where we can actually go in and pull the blood clot out of the artery and open up the artery so blood returns to the brain. Both of these treatments are extremely time sensitive. So as soon as you notice any of those signs and symptoms from Be Fast, call 911 and get to the nearest emergency room. As the quicker we can give these interventions, the sooner you'll be able to recover and get back to your normal life.
Thank you so much, Dr. Baldwin. This helps us raise important awareness. We appreciate your time. And for everyone at home, if you missed anything, we will have this full segment posted on triadcw.com later this morning.